Now let's turn our attention to our coverage of the coronavirus pandemic. The Nigeria Center for Disease Control reported 1,056 new cases of COVID-19 overnight, taking the country's total number of confirmed cases to 141,447. Lagos recorded the highest number of new cases with 240 new infections, followed by Osun with 120 new cases. The Federal Capital Territory had 116 cases, while Plateau recorded 88 new cases. So far, 115,755 people have been discharged, while 1,694 people have died from COVID-19 complications. Now, the federal government has placed a fresh travel restriction on 100 passengers for flouting its directive on COVID-19. The Presidential Task Force on COVID-19 in a tweet released the passport details of the defaulters and said they have been restricted from traveling for 6 months. It says the defaulters failed to comply with the mandatory Day 7 post-arrival COVID-19 test and will face 6 months travel restriction from February the 5th to July the 30th. Federal government also knows that the travelers had been notified and barred from traveling out of the country during the period. A public health physician, Nsabasi Kanem, is here with me to discuss this. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
Now, let's look at the measures being put in place by government to check the flow of perhaps, let's say, talking about the protocols. First of all, ensuring compliance. And we see the government has said, proposed a 6-month jail term, and now it is barring about 100 persons from traveling because they flouted the protocols. How do you see this perhaps stemming the tide and, turning things around when it comes to ensuring there is enforcement of the protocols and that people adhere, and possibly at the end of the day we see a flattening of the curve of infections?
Well, I want to say that this is a very, very interesting move. I mean, I'm quite excited to learn about this. Within last year, towards the end of last year, we saw a lot of cases of people coming with fake COVID-19 tests and all of that. Of course, you know that normally people would want to flout the law because they feel that perhaps there will be no surveillance. Even if there are surveillance, they can always have their way around it. But with what has been done, this is more like an example to others that, look, we are no longer in business as usual. Now we are clamping down people who want to take deliberate steps to undermine the efforts that is being done so far. I know how much the country has spent in terms of surveillance at all the ports of entry. And people still want to come in when you know that we are having new strains of the virus in different places. Look at the one in South Africa. Now, the one in South Africa, let me tell you something, is quite bad because it binds very, very highly to the ACE receptor in the nostril, the nasopharyngeal orifice. And with that, it is transmitted much faster and kills more. Now, if we do not strengthen security borders, border surveillance, then we might have people bring in this new strain.
We already have 13 of the UK strain in the
honestly,
country.
And the last thing we can do right now is to bring other strains like the one in South Africa. So the government has to even go ahead and, enforce this rule. Anyone who feels that he or she is bigger than the law will be shown that he or she is not bigger than the law. In fact, as a matter of fact, beyond even travel ban, people should be prosecuted and sentenced to jail.
6 months jail term already.
Okay, 6 months jail term.
There is a 6-month jail term.
Exactly. That is the kind of thing we want to see. I want to see more people because I know that a lot of Nigerians are still doing this. So we want to see more people being prosecuted and being sentenced to terms in
But
in
for
prison.
some persons, with the state of our prisons, correctional centers, they are saying that perhaps we should look at other measures for treating people who flout the laws, ask them to do community service, perhaps ask them to pay a fine, perhaps send them to these centers, isolation centers, to work to see how things go there. Because correctional centers are somewhat filled already, and now saying that 6-month jail term, how do we go about it? And we know our justice system, criminal justice system.
Yeah, I understand that, but you see, a lot of times these people that flout these rules, in all of the things you've mentioned earlier, they can quickly handle it. Community service, who told you that I'm really going to do it? And we've seen cases where people boycotted it. Now, is it fine? They'll pay. They don't. Money is not their problem. I'm telling you practically what is going on. Now, the reason why jail term is still very, so that you would learn it the hard way. People need to learn it the hard way. You know, we are even talking about, if you go around the street, you are telling people that please try and maintain social distancing. The other time I was moving around some churches, maintain social distancing, try and put on your face mask. People are not listening because they feel that maybe
nothing will happen.
Nothing would actually happen. Let people serve terms imprisonment, and I can assure you that others will learn.
Right.
Others will really learn.
All right, let's take again a look at the vaccines that we are expecting in the country. We're told that Nigeria will get about 42 million vaccine doses from the AU, perhaps by the end of this month. And the government is looking at vaccinating about 45% of the population towards latest by the end of the year, perhaps trying to achieve herd immunity when it comes to the COVID-19. But then again, there are questions as to logistics. Are we going to be able to actually achieve that? Because the government is saying that it will put in place the cold chain that was used for polio when, talks about we having the capacity to, handle the vaccines. And there are questions as to logistics, if that would be enough, the storage, the temperature, and all of those challenges. What concerns do you have with all of the plans being put in place by government ahead of the vaccine?
Okay, let me put it very clearly. First of all, as far as Pfizer vaccines are concerned, because that is the main issues right now. Apart from Pfizer and Moderna vaccine, the other ones can be stored at normal vaccine temperature of 2 to 8 degrees Celsius. I would make bold to say that as we speak now, we have ultra cold fridges, yes, at the National Store in Abuja. And that can even give us a temperature of minus 85 degrees Celsius. So we have those facilities to store those vaccines. Yes, probably the question you want to ask me is how do we move them from the national store to the places where...
To the states.
To the states, and of course probably the LGAs. For that, because I had a meeting with... we had a meeting with the National Primary Healthcare Development Agency on Monday, and so we discussed some of these concerns. And the outcome of the meeting was that from the national level in Abuja, the vaccines will be moved to zonal, depots, from the zonal offices, zonal warehouses, so to speak, where we will still have the ultra cold fridges. Yes. Now it will now be moved to the local government using dry ice pack. And then I want you to also know that for COVID-19, that is the Pfizer vaccine, it can be kept off that temperature for up to about 24 hours, yes. And so that means that vaccines will only be dispatched based on need. And so once it's dispatched, that batch must be used throughout that day before the next batch comes in. Perhaps the main problem that we have, the main concern, even at the meeting that we had, the main concern that we're having is you're looking at achieving herd immunity. Herd immunity you can only achieve when you have vaccinated at least between 70 to 80% of the population. That is, we're looking about maybe 140 to 160 million people in Nigeria. Right. Now, the question is, how do we achieve this in just 2 years? I mean, practically, with what we have and the fact that our public health system is already overwhelmed, what then do we do? As a matter of fact, at the end of that meeting, we came up with some sort of suggestion that, look, I think there are some, we can utilize the community pharmacy. We're looking at we are learning from what other countries are doing. The US UK, Georgia, many other countries are trying to see how they can decentralize these services, ensure that we bring in other providers. For example, community pharmacies serve at the community level. Now, they have some advantages that are already pre-existing, which we feel that we can leverage that to make sure we reach more people.
Right.
Now, how do we do that? For example, for community pharmacies, they have already cold chain system, because most community pharmacies supply cold chain from oxytocin to insulin to vaccine. They do that. So they have that already. Now we can train pharmacists, to be able to provide those services. And by so doing, we would decentralize it. Now Nigerians can have easy access. Now, if probably you bring in maybe like 5,000 pharmacists, that is, you are increasing the number of providers. When you do that, definitely you you shorten the time that we can reach out to these 140 million people, and of course shorten the time that we can achieve herd immunity. So this is sort of a strategy that can help us, which is one of the things that we discussed at the meeting on Monday.
But the government is saying that it is not going to involve the private sector when it comes to the administration of vaccines. So I wonder how that comes to play, how successful that can be.
Well, honestly, let me say very, very clearly here. On Monday, I actually made my reservation very well known. As a matter of fact, I said that I like to back everything that I'm saying with science.
Right.
Mathematically, calculated. What is the total workforce? How many? We looked at it, we have about 60,000 health workers. Now, over how many facilities? Now, remember that these public facilities, a number of them are still handling the active cases. Right. Now, let me tell you some other thing. Perhaps this is what guided the UK and the USA. Right now, as I speak to you, Nigerians already tag clinics or hospitals as COVID-19 hotspots. They feel that the risk of probably acquiring COVID-19 in the hospital as a nosocomial infection is high. So there is that apathy for even going to anywhere called the clinic. And that is why we need to bring in other providers. We need to bring in the private sector. Because I can assure you, I'm saying this on good authority, the current public health system that we have cannot distribute COVID-19 vaccine to 140 million people in the space of less than 24 months, because we're already in February.
Yes.
So it is not possible for us to achieve that. That's why we need to think innovative. Joe Biden said that over 40% of American population will receive their vaccine through the private sector. So what are we trying to do? Now we're at the meeting, we talked about using mobile facilities. Mobile facilities are quite expensive. We know that. I've been involved in a project that we use mobile facilities. It is very expensive. Why not use private clinics, community pharmacies? Let us have an integrated system that is targeted at achieving 140 million people in less than 20 months.
Right. Now, another issue is the vaccine itself, talking about AstraZeneca that we saw South Africa purchased, and the fact that they are saying they had to, withhold vaccinating certain persons because they were disappointed by the result they got. And that is what Nigeria is looking forward to acquiring. And the concerns for some persons is that shouldn't we be putting that on hold, seeing what results South Africa is getting? Yeah. Because although the strain seems to be different, but then should we still go ahead with acquiring this vaccine, seeing the results South Africa is getting? Well,
let's put it in context, right? Fine. In Germany, people above the age of 65 have been excluded. In South Africa, of course, we know that South Africa has the new strain in South Africa is now the dominant strain there. Right. Now, we are also learning lessons from what is happening in other places, in other countries of the world. It's not only UK, it's not only South Africa that is using AstraZeneca vaccine. We are looking at what other countries are doing, and we are seeing the successes already. Now, let me put it very clearly. Now, the COVAX agreed to give Nigeria about 16 million doses of the AstraZeneca vaccine. And let me also say that that is not the only vaccine that we are going to use, because, mind you, for AstraZeneca vaccine, we are not administering it to people above the age of 65 based on the preliminary studies that have been carried out already. We are looking at bringing other vaccines like Johnson & Johnson vaccines, so that can appeal to the older population. But we need to benefit from this facility that we are getting from COVAX. And I would say that apart from South Africa, many other countries are already reaping good benefits from the use of AstraZeneca vaccine, especially based on the fact that it can be stored at 2 to 8 degrees Celsius, which is not achievable with Pfizer or Moderna vaccine. So putting in context, we will still go ahead with the AstraZeneca until we have sufficient reason to believe that it is that this new strain, this South African strain, is in Nigeria and it is a dominant strain. But as we speak now, the strain that we have is still susceptible, or it could still be prevented using AstraZeneca vaccine.
Right. But then again, the concerns for some experts is the fact that attitude towards vaccine, what government should be doing now because of the stories we are getting from across the world.
Okay.
Yes, so we see what is happening in South Africa again. We see in other countries where some persons are outrightly refusing to, get vaccinated. What should Nigeria be doing towards that, seeing that this is what we are looking forward to acquiring as soon as possible? Well,
let me say that there are a lot of plans in place. At the meeting we had on Monday, we were able to look at some of those plans that we have. Media engagement is one of them. But one of the things that we were able to reach out on Monday was that, again, I go back to community pharmacy because the community is very, very key. And I can tell you, vaccine hesitancy is a reality in this country as far as I'm concerned. Now, we are looking at working with the community pharmacy. They are coming in. As a matter of fact, it was a meeting between stakeholders. We had Association of Community Pharmacists of Nigeria. They were there. So, and as a matter of fact, we reached out to an agreement that community pharmacists will come in to engage people at the grassroots. Now, the media is there, religious leaders, because we know a lot of persons would want to believe. If you remember the genesis of this whole thing, it was one pastor who said that COVID-19 is this and this and that, and people believed it. So we want to also utilize this same mechanism, this same channel, to also reach out to them, tell them that, look, this vaccine is safe. We are using traditional rulers, we are doing jingles, we are doing billboards. In fact, there is a lot in the kitty as planned by the National Primary Healthcare Development Agency with partners to ensure that we educate Nigerians, because once we
shouldn't that have started now? Since
unfortunately, it should have started long ago.
Yeah.
But you see, honestly, it's only unfortunate that we only started now. All right, we've started now. I've seen a few engagements. Of course, one of the suggestions I made was there in the meeting was that we need to engage media with high viewership. Not some TV station that nobody knows where they are. Honestly, I said that, and I think that was taken very well. But we need to make sure that we use every media channel in our disposal to make sure that we reach out to people. And it must be a two-way communication. You don't just send information to people without probably addressing their feedback. Because you tell somebody, okay, vaccine is safe, and it tells you, I heard that people can grow horns. I heard that people will slump. I've seen videos, I've seen WhatsApp messages, and all of that. You need somebody. That is why I really, really emphasize the use of community structures, pre-existing community structures, which one of the things I mentioned there was the use of, community pharmacy, because there's that routine engagement with people. Okay, these are your concerns. This is what. And let me tell you why I really, really talk about pharmacy. Because pharmacists are, should I call them drug experts? They know everything about the vaccine. They know what will happen. They know the mechanism of the vaccine. Everything about the vaccine, pharmacists know. So you are not going to argue with them. Once they tell you that, look, this thing is going to be safe, after all, they dispense drug to you, and they will tell you about the drug. And I can tell you with all precision, you see that everything plays out exactly as the pharmacist told you.
Right.
Now, so we need to use these experts at the community level. Let them interact with people routinely and tell them, look, beyond what you heard, or aside from what you heard, let me tell you that these vaccines are safe. I'm saying that because I am a pharmacist. It works better. They listen and they understand. Remember, there's that level of trust already.
Right, with them.
With them. So we need to utilize it, and we need to start now. And one of the things I really emphasize, we need to begin the campaign, the awareness now. Because once the vaccines come in, I can assure you that we may have those vaccines. But honestly, we may not have somebody to pick it up.
Right. So that leads me to my final question because of want of time. Homegrown solutions. Yes, we are receiving vaccines, but how do we move from here? We can't keep waiting for what comes outside. We see vaccine nationalism already, but then we see the struggles we are going through to acquire vaccines. Moving forward, homegrown solutions.
Exactly. Thank you very much for that question. You see, few weeks ago, I was interviewed about this same thing. I said, look, I am utterly disappointed to be, as a public health expert, I'll tell you that I'm disappointed at what we are doing currently. Now, we are now depending absolutely on other companies from the other side of the world for something that is life-saving as vaccine. Who does that? What happens to our institutions, the educational institutions? There was a time a vaccine was on in the works at I think at one university there in somewhere in Osun State or so, and I was following the progress of that vaccine. At the point I heard nothing. The last thing I heard about the vaccine was that they were asking the government to please provide funding for that vaccine to move forward, for the development to go forward. That was the end I heard about it. We need to develop, like you said, homegrown solutions. Nigeria, in fact, the entire Africa needs to sit down together and say, look, where are we? How can the entire African continent not boast of a single vaccine? Look at, we have about 55 candidate vaccines across the world. None is coming from Africa. It is a big slap on our jaw. Honestly, as an African Union, as entire as a Nigeria, we need to work together, go back to the drawing board, put our acts together and make sure that we develop solutions like this so that we don't have to go through what happened when other countries, because right now, these manufacturers are more loyal to their country.
Absolutely.
And because of that, they would save their country first before saving you.
Before saving other countries. We must leave the conversation here now. Public health physician Nsai Bassey Ekanem, thank you so much for your time.
Welcome.